Hi, and welcome to the Unit 2 video. It's kind of a lecture series that we're presenting with the different units. There is a lot of information in each unit, and we're trying to break that down to just the types of content and concepts that you need to know. This particular one goes all the way back to cellular biology, kind of that granular level to how things are really happening down at that cellular level, pathophysiologically. So let's look at the cell for a minute here. There's a lot going on in the cell. We have many different parts. So refamiliarize yourself with what the cell looks like, the different parts of it. For me, this reminds me of when I was in grade school, junior high, and I had to make my cell and take it to school. Um, yeah, that's what we're going back to. So refamiliarize yourself with this and with what each structure does. Think about the different types of cells and what type of function they fulfill. So muscle cells, for instance, are responsible for movement. Nerve cells conduct energy, um, or conduct sensation. I apologize. Metabolic absorption. That's something that's going to happen more in the renal or intestinal cells. Not all cells have the same function. Some are more specialized. Excretion, that's more of like a mucus gland, adrenal, testes, ovary cells. This occurs in the plasma membrane, the membrane that surrounds the cell. That's where the secretion and excretion happens. Every cell must eliminate waste, and that occurs in the vacuole. Respiration happens in every cell, and that's in the mitochondria specifically. Um, Reproduction, every cell must grow and reproduce. That occurs in the nucleus, especially where the DNA is replicated. And then communication is a cellular function, especially of like pancreatic cells with insulin, and a few other types as well. But those are the main cellular functions that you need to be aware of for this course. Movement of a solute particle from an area of greater concentration to an area of lesser concentration is called diffusion. I realize we're going back to the basics again, but let's review here. Filtration is where movement of water and solutes through a membrane, um, or the movement of water and solutes through a membrane happen, which is called filtration because of more force on one side than the other. And then osmosis is the movement of water down a concentration gradient across a semipermeable membrane. Cellular reproduction happens just like this. You have the duplication process that occurs, then mitosis, where the DNA kind of moves to the opposite ends and the cell splits into two, which is called cytokinesis. The two cells that are produced from the one are called the daughter cells. When a cell shrinks, it's called atrophy, and we see that especially in the brains of aging adults. Hypertrophy is when a cell increases in size. A good example is left ventricular hypertrophy. Hyperplasia is when there's an increased number of cells due to increased cellular division, such as in liver regeneration. When the liver is injured and regenerates, this is what happens. Dysplasia is when there's an abnormal size, shape, and organization of mature cells. This is found on the epithelium in different types of spots on the skin. And then metaplasia, reversible replacement of one mature cell by another cell type, often found in tissues exposed to toxic chemicals or carcinogens. Interestingly, in pregnancy, both hypertrophy and hyperplasia occur in uterine tissue to accommodate the growing fetus. So let's talk about isotonic, hypertonic, and hypotonic solutions. Take a look at this illustration. Look at the hypotonic solution and what happens with the body cell. In an isotonic, things are in equilibrium on the inside of the cell and the outside. In hypotonic, the hypotonic body cell is filling up because there's so much solution on the outside that it's going down the osmosis gradient and filling the body cell. In the hypertonic solution, fluid is leaving the cell because there's more solute on the outside, and therefore that type of environment needs more fluid. So we have electrolytes in the body. Let's review. Look at the sodium, potassium, calcium, magnesium, and chloride levels. Refamiliarize yourself with that and where those are found. Sodium creates much of our osmotic pressure, as we know. Higher sodium pulls in more fluid and causes hypertension. Low sodium does the opposite. Potassium creates also much of the osmotic pressure in the intracellular fluid. Calcium is found in bones and teeth and maintains normal excitability of neurons and muscle cells. It's essential for blood clotting. Magnesium, 50% of it is found in bones. It's more abundant in intracellular fluid than in extracellular fluid, and it's essential for ATP production and activity of neurons and muscle cells. So it's really integral in the production of energy within the cell. I'll go ahead and let you take a look at the rest of that here for a second. All right, still reviewing here kind of quickly, as you can tell. The pH, as we know as nurses, pH is very important. Less than 7.38, and I always considered less than 7.35 acidic, and that can be a respiratory or metabolic acidosis. With respiratory, the PCO2 is greater than 45, and with metabolic acidosis, the bicarb is less than 22. With a high pH, we're looking at alkalemia, respiratory alkalosis, a PCO2 of less than 35, and a metabolic alkalosis is a bicarb greater than 26. And there are some examples of what can cause those. Switching to genes, genetic diseases. There are different types of patterns of genetics being passed on. Autosomal dominant is when one parent is affected and the mutation is carried only on one gene. There is a 50% incidence rate of one of the children, either boy or girl, being affected. In autosomal recessive, it's a recessive gene, and you would actually need two carriers for a child to get it. And that would be a 25% chance for a child to have it, either boy or girl, and 50% chance of it being passed on for a child to be a carrier. So take a minute to look at this table and refamiliarize yourself with autosomal dominant and autosomal recessive genetics. Okay, incidence. This is the number of new cases within a period of time divided by the number of people. That is different from prevalence, which is just the proportion of a population affected by disease at a specific point in time. Many diseases are multifactorial with a genetic component. So as we know, as healthcare providers, getting a family history is very important. What is cystic fibrosis and how is it transferred? How can you counsel a patient at risk of gene transfer? I want you to look this up. I encourage you to go back to the textbook and look up cystic fibrosis. It's a really interesting disease. it impacts the pancreas and causes there to be an excess of mucus, and this really is impactful in the lungs. Patients tend to get pneumonia pretty easily and are constantly needing help getting that mucus out of the lungs. Autosomal aneuploidy, also called trisomy. It can occur for any chromosome at conception, but the most common is seen in live births are trisomies of the 13th, 18th, or 21st chromosome. The 21st chromosome trisomy is called Down syndrome. Fetuses with most other chromosomal trisomies do not survive to term. Sex chromosome aneuploidy are syndromes that arise due to carriage of an atypical number of X and or Y chromosomes beyond the typical female or male complement. So Klinefelter syndrome is genetic. Males carry an extra X chromosome, so they're XXY. They have low testosterone production, reduced muscle mass and body hair, enlarged breast tissue. They're usually taller than average, sometimes described as shy or sensitive, may have difficulty socializing, and even problems in school. Turner syndrome affects only females and results when one of the X chromosomes is missing or partially missing. It can cause a variety of medical and developmental problems, including short height, failure of the ovaries to develop, and maybe even heart defects. Then we have alpha thalassemia. This is an inherited blood disorder passed down from one or both parents. The body makes less hemoglobin than normal, causing mild or severe anemia. The severity and type of anemia depends on how many genes are affected. Okay, innate immunity, inflammation, and wound healing. The purpose of inflammation is really to destroy foreign invasive microorganisms. But we know now that our bodies don't often respond appropriately. We have problems with allergies, problems with our immune systems becoming inflamed because of issues that really aren't that important. Maybe something in the environment or foods, not necessarily a bacteria or a virus. Anytime there is an inflammatory process, there is increased vascular permeability, which sometimes means increased edema. B and T lymphocytes mature in the bone marrow and become B cells, then travel to the thymus, spleen, and thyroid to enter final stages of differentiation and development. And of course, those are very essential in the immune response. Passive acquired immunity are antibodies that are transferred from donor to recipient. Active innate immunity are antibodies actively working against an invader and are acquired by genetic predisposition. Active acquired immunity are antibodies actively working against an invader and acquired by previous exposure or immunization. And passive innate immunity are antibodies given to a person rather than the immune system producing themselves. So an example is a baby receiving antibodies from the mother through the placenta. Okay, now we see some inflammatory autoimmune skin conditions. Allergic contact dermatitis is very common. That's when we come in contact with something and develop like a rash on the skin, and that is a T-cell mediated hypersensitivity. Stasis dermatitis occurs usually on the legs because of venous stasis and edema. Irritant contact dermatitis is caused by activation of the immune system because of the pro-inflammatory properties of chemicals. Atopic dermatitis is a common example, is eczema, and it is related to a gene variation that reduces skin moisture and leads to damage and inflammation. Erythema multiforme is inflammation of the skin with minimal or no mucous membrane involvement and no systemic symptoms. Acne vulgaris, that's adolescent acne, and there's inflammation of the pilosebaceous follicle. Lichen planus is a little different. It's for older people, usually over the age of 30. It's benign. Autoimmune inflammatory skin and mucous membrane disorder causes extreme itching. People with this disorder often describe intense itching that really can be very horrible. I mean, it actually can cause them to to not be able to go to their job, to be able to be active in their life because they're so taken with this itching and scratching. The next one, I'm honestly not exactly sure how to pronounce. I think it's pityriasis rosea. This is an itchy skin rash, usually occurring in children and young adults, most likely caused by a herpes-like virus. It goes away within about 3 weeks usually. A furuncle is a hair follicle infection that extends to surrounding tissue. Usually, sometimes might need an antibiotic to clear up. And then actinic keratosis is caused by UV exposure and is a precursor to squamous cell carcinoma. Carcinoma refers to dysplastic epithelial cells that have penetrated the entire thickness of the epithelium into the basement membrane. So this is a problem. It will need to be removed, usually surgically. A primary malignant tumor characteristic, the biggest characteristic, really the primary characteristic, is a lack of organization of cells. Causes of malignancy: obesity, tobacco and alcohol use, heredity, exposure to chemicals, some infections. What is not a cause of cancer? Exercise. In fact, in a way, exercise might prevent cancer if the cancer is caused by obesity. Causes of the following cancers: Wilms tumor is congenital and is contained on a genetic mutation. Leukemia is congenital, hereditary, caused by increased exposure to radiation, tobacco smoke, and maternal exposure to pesticides. Liver cancer can be caused by hepatitis B and C, estrogen, progestogen, contraceptive, tobacco smoke exposure, aflatoxins, alcohol, a couple different types of liver fluke parasites, plutonium thorium-232 and its decay products, radiation in other words, and vinyl chloride. Cervical cancer, as we know, can be caused by HPV, estrogen, progestogen, contraceptives, HIV type 1, tobacco, and diethylstilbestrol, and that would be exposure in utero. Two types of anti-cancer drugs that we kind of want to shine a light on are glucocorticoids. Some people don't really understand what those are used for. To benefit a patient with cancer, the dosage must be very high, and it's usually used in combination with other agents to treat cancers arising from lymphoid tissue. That can be acute and chronic lymphocytic leukemias, Hodgkin's disease, non-Hodgkin lymphomas, and multiple myeloma. Glucocorticoids are beneficial because they are directly toxic to lymphoid tissue. With prolonged treatment, toxicities can occur, and this is one reason, we don't want there to be prolonged treatment with glucocorticoids, because it can affect the skin, osteoporosis, adrenal insufficiency, increased susceptibility to infections, ulcers, fluid and electrolyte disturbances, myopathy, diabetes, and a few others. The selective estrogen receptor modulators, SERMs, are used oftentimes in breast cancer. One of the common ones is tamoxifen. It is the oldest and most prescribed selective SERM, and it's used for women and men diagnosed with hormone receptive positive early and advanced stage breast cancer, often used after mastectomy to reduce cancer recurrence risk. And it reduces breast cancer risk in women who haven't been diagnosed but are at higher than average risk for the disease. So maybe they've had the DNA studies done and show that maybe they have the BRCA gene and they need to take the tamoxifen possibly to reduce their risk of breast cancer. That is it for the slideshow of Unit 2. All of the illustrations were taken from our text. And if you have any questions, please let us know. We're just shining a light on the most important topics that you need to be aware of. And hopefully you are learning from them. Thank you.